Hi, my name is Portia Griffin, and today I will be presenting a speech over behind the scenes of nursing after the pandemic. Nursing is an art, and if it is made to be an art, it requires an exclusive devotion as hard of preparation as any art painter or sculptor's work. Quoted from the founder of nursing herself, Florence Nightingale. Nursing burnout is one of the biggest issues next to the shortages that have really gone unaddressed in a proper way. After the pandemic, we have seen many changes that it has done to our healthcare system. Post-pandemic, nursing burnout and shortages have emerged in a significant problem exacerbated by the immense pressures faced during the crisis. The pandemic highlighted vulnerabilities within the healthcare system for the needs of systematic changes, addresses workforce sustainability, improve working conditions, and provide better support for our nurses. This has prompted the reevaluation of healthcare practices and policies to ensure a more resilient and supportive environment for our healthcare professionals. Over the past 4 years, I have been a frontline worker through the roughest times, seeing patients fight for their lives and witnessing families grieving, working nonstop. The moment was felt so surreal after losing a parent during this time. The burnouts I felt during this time have made its way over to 2024, leaving us with nursing shortages. It's sad that some nurses now have found other jobs or retired. Nursing as we know it today has evolved and changed over time, developing newer ways of caring for patients. The pandemic alone created a significant impact towards nursing itself and how outcomes are being evaluated. For the next few moments, I'd like to share some of the key points pertaining to some of my fellow nurses who have put their lives at risk during this tragedy. The pandemic has had its biggest impact on countless families, causing the loss of loved ones. COVID-19 has been one of the worst viruses to exist on Earth. In December of 2019, the deadly virus made its debut in China with its official outbreak in a local market. Given extensive travels between countries at this time, the spread of COVID-19 reached many parts of the earth, including our own home, by February of 2020. The fearful disease wiped out thousands of lives, affecting both healthy and unhealthy individuals and individuals with underlying conditions. From 2020 to 2023, the way of living was intense and unpredictable, involving us wearing masks, sanitizing everything, maintaining a 6 feet distance, and enduring curfews and lockdowns for months. The pandemic resulted in a devastation of thousands of lives being lost, profoundly affecting the communities worldwide. Daily life, as marked by intense safety measures and prolonged lockdowns, fundamentally altering routines and social interactions. The emotional impact was severe, with many experiencing trauma from witnessing widespread suffering and the loss of loved ones. As I stated before, nursing has changed tremendously over the past few years. The nursing burnout had grown significantly over time due to the high demand of care and devoted hours for critical patients. The significant increase in the nursing burnout has been driven by the high demand for long hours in critical care for patients, especially during the pandemic. Nurses have faced immense pressure to manage heavy workloads and provide continuous intensive care, leading to physical and emotional exhaustion. This has highlighted the rising importance of mental health, prompting changing perspectives on the need for better support systems for our healthcare professionals to maintain a well-being. In the New York Times, one of the nurses shared her feelings as followed: "I was thinking, what is this girl doing that justified her not letting me in?" Ms. Camacho, 27 at the time, recalled. "And I just felt the surge of rage." She hung up the phone and screamed and cried the rest of the drive home. To read the many stories of how nurses felt after long hours of stress, anxieties, and sometimes depression should be considered important in the workplace and included as much as possible. Mental health has become mental health has become a priority that I see change how nurses, nursing assistants, doctors, and other healthcare professionals have the view of the healthcare world today. Becoming a nurse, I never thought I would have the experience of stress and anxiety until now. So many nights and days passed without getting the proper amount of rest or having energy to pull through. As a 3-year nurse, I was thrown into learning how to manage and work heavy patient loads between 5 and 9 patients my first year. Not only was the patient load high, the very critical care was high also. Dealing with what was called the Delta variant of COVID that took over in 2021, among that same year, nursing shortages started to occur shortly after. Leading up until the shortages in nursing, contracts were being made and posted for nurses willing to work. It was also said that COVID came in as a blessing or a curse to those who took it upon themselves to seek whether they would want to risk their lives to make money or stay home and avoid the virus. During the first couple of years of the shortages, the hospital recruited many nurses as possible, as far as new grads, temporary nurses, or retired nurses. In an article published back in 2021, it states that in the United States, it is projected that 1.1 million nurses are needed to replace retiring nurses by 2022. Globally, there will be needed 13 million. And as follows, there are many nurses needed. Due to such a high demand within the nursing programs, were waiving so many requirements that the nurses could be trained and equipped with the skills needed to provide for the patients they would come in contact with. As for today, the pandemic has slowed down, but the nurses now are regrouping and trying to maintain getting their old lives back. Traveling with nursing, especially during that time, was interesting because you got to see and experience different hospital settings. Many travelers had the opportunity to make their own salary in 13 weeks compared to working a year. The downside of it all was some nurses were used to being with their families and loved ones, and often at certain periods they would have depression when they got homesick. As I close this speech, I hope this message helps you understand a little bit more of what nurses go through on a daily basis, even after the pandemic. Nursing, as we know it today, has evolved and changed so much, developing new ways of caring for patients. Along with the pandemic, it has a significant impact towards nursing. Remember, the next time you see a nurse who may have had a rough day or a rough week, tell them this: not all angels have wings, some have stethoscopes. Every nurse needs a little uplifting. Thank you.